All
Rolling.
right, phone's on vibrate, okay. So doctor, what you're gonna do is introduce yourself and your role, just, you're a podiatrist here at West Jeff, and just give me a quick overview of your practice. Just like the type of patients you see, and then we'll pause,
Okay.
okay? So it'll be kind of like meet the doctor.
And then talk to me.
Yeah, and you're gonna look to
To
me.
look at
Okay.
her.
So doctor, thanks so much for doing this today. So, give me your name and tell me a little bit about the overall about your practice.
Sure. I am Denise Elliott. I am in private practice here at West Jefferson Medical Center. We see any kind of foot problem that walks in the door, which can involve the skin, the bones, sprains, and strains. We work 5 days a week and do surgery 2 days.
Okay, what type of patients do you see? I mean, what type of symptoms or conditions do you treat in your practice?
We treat all conditions that can range from bunion surgery to nail problems to breaks, tendinitises. We take x-rays here.
Okay, that's
Okay.
fine. Okay, so let's talk about some of the more common problems that people, seek, obviously, help from a podiatrist. Let's talk about plantar fasciitis. So when I ask you a question, repeat the question in your answer, because I'm not going to be on camera, so it's just all about you. So what is plantar fasciitis?
Plantar fasciitis is a strain of the plantar fascia. The plantar fascia is a structure that runs on the bottom of the foot. It helps support the arch and inserts onto the heel. When you get plantar fasciitis, it usually involves one band closer to the arch and extends into the heel. Causes a lot of pain, especially upon standing in the morning, and it can really interfere with daily activities.
Okay, how is it caused? How does plantar fasciitis happen?
Plantar fasciitis is a strain of the tendon. Most commonly we see it with people who wear non-supportive shoes, a lot of flip-flops, or just flat shoes, walking barefoot. It can also happen if you're having a rapid weight gain, or if you're getting a little older, participating in sports, what we would call maybe a weekend warrior, somebody who starts exercising all of a sudden without doing proper stretching of the foot.
Okay, so now let's talk about some of the most typical symptoms that people experience with plantar fasciitis.
Symptoms of plantar fasciitis would include pain, sharp pain in the heel or arch, usually upon standing first thing in the morning. It can also get very tender when running or after standing for a prolonged period of time.
Okay, excellent. You're doing great. Okay, so now let's talk about diagnosis and then treatment options.
When a patient shows up with the complaint of plantar fasciitis symptoms, we would often take an x-ray to rule out possible heel spur or any other heel pathology, a cyst in the bone, just to make sure it is truly plantar fasciitis. Then, forgot the second part of your question.
That's fine. No,
Okay.
and we'll pause there. Okay, so now let's
Okay.
talk about treatment options. What are the treatment options for plantar fasciitis?
Treatment options for plantar fasciitis are most often conservative treatments. 95% plus of patients will respond completely to conservative treatments without needing surgery. So we'll usually start with a very good stretching program. We usually demonstrate at least 3 or 4 different foot stretches. We have a patient do them in repetitions of 10, at least 3 times daily. We'll also have them start using ice therapy 3 times daily. We make sure that they're in appropriate supportive shoe gear. It could be a supportive sandal. Most often it's a supportive insert added to their current shoes. We usually put someone on an anti-inflammatory since it is a inflammation of that tendon. That's usually our first line of treatment. About 2 weeks later, if they're still in pain, we might then have to add a cortisone injection directly into the fascia or refer them to physical therapy for further treatments.
Okay, and are there any surgical options or treatments for plantar fasciitis, or is that a really more of an extreme case?
After 6 months, most people have completely healed their plantar fasciitis with the conservative treatments. We might try up to 3 cortisone injections within that time frame. We might get more advanced and start using night splints. We might even put them in a cast or completely immobilize them, stop them from running and any heavy weight-bearing aerobic exercises. Then, if they're still in pain, we might have to resort to surgery.
Okay. But again, so what about patient satisfaction with this type of with the treatment options that you just discussed for plantar fasciitis? Most of them they go back to their everyday
Most
activities.
people, once the conservative options have improved their symptoms, they can completely return to all their activities without having any further problems with the plantar fasciitis.
You're great. great. That was perfect.
We have to redo that one.
Okay, I talked over her.
No,
Oh.
it just got really overdriven.
Okay, so let's just,
Okay.
I like how you ended that, that most
Okay.
people are happy, they go on. So
Correct.
again, final outcomes, are patients satisfied with the treatment for plantar fasciitis?
Most people respond very well to the conservative treatments and are very satisfied with the results.
Excellent. I think we got what we need for plantar fasciitis. All right,
Okay.
so same thing, bunions, my favorite topic.
Do you need the foot up there? on the
Yeah,
screen?
let's put the
It
foot
went to
back up
sleep.
there.
Did it go to sleep?
Yeah, that's fine.
I
Yeah, I
wasn't paying
think so.
attention, but
I
I
noticed it,
just
but it was
noticed
right in
it.
the middle, so I was like, we'll
I
just leave
don't
it.
know what I did here. Let's close this. Let me just see. Okay, let me reopen and see if it's any better.
That's fine, because we'll hardly see, like, even if, as long as there's
Oh.
something on the screen, even if it's, anything,
Okay.
better than a black screen.
Okay. I don't know why I can't. Oh, here we go. Let me do this.
there you
Ooh,
go.
that looks good. That looks like my
Making it
foot.
whiter, is that better?
Yeah, that
Oh,
looks like my foot.
okay.
All right. Move a little, yep, perfect. We're good?
Yep.
All right, doctor, my favorite topic, bunions. What are bunions and who gets bunions?
A bunion is a bump that develops on the base of the great toe. It usually is caused by genetics. Most people inherit their bunion. Usually the bone structure of a person is passed on generation to generation. There are some other causes of bunions which would not be as common, including arthritis, some neuromuscular diseases, some hypermobility issues, but most commonly is something hereditary.
Okay, and so now, what are some of the symptoms of, painful bunions?
A bunion can become very painful as the bone enlarges and the deformity increases, which usually occurs with aging. As this happens, especially for women, if they're wearing a tighter shoe or a heeled shoe, this will compress on the prominent bump and cause skin irritation, calluses. Since most of the pressure goes through the bunion, this can also start causing joint pain, difficulty with walking, some throbbing, joint pain.
Okay, and so now when people are experiencing bunion pain, what are their options? I mean, what do they do?
When a person starts having pain and symptoms with the bunion, we would first start with conservative treatments. Usually we'll have them add what we call a bunion pad, which is more of a cushion, not medicated, just something to protect them from pressure, usually from shoes. We'll try to get them to start wearing maybe an open-toe shoe, a wider shoe, something without a heel on it, limiting the heel height to under 2 inches. If the joint pain becomes severe, we might prescribe an anti-inflammatory or other medication just to help control the pain.
Okay, and for those who, that's is that a short-term treatment option, or, not everyone needs surgery, right? Or
With
most
bunions.
most people need it, right? Okay, no, that's fine. So now let's go and then, let's move on to, and another treatment option that we offer is, and tell me about all the surgery.
Once conservative treatments are no longer helping alleviate the pain, we often have to consider surgery in order to actually correct the bunion and the bone contracture. So surgery can involve something as simple as shaving off the prominent bump, which is done in the operating room, or sometimes the bone will need to be cut, shifted over into correct alignment to alleviate the pain.
Okay, so now tell me about the actual procedure itself and recovery time.
Bunion surgery recovery will depend on the surgery that was performed. A simple shaving of the bump can be done usually under local anesthesia. It has to be done in an operating room setting, and weight bearing is allowed immediately post-op. Now, when the bone has to be cut and shifted and screws placed into the bone, that involves a little longer recovery period. Usually it's 2 weeks without walking on it, but then weight bearing in a protective surgery boot. At the 4-week point up to 6 weeks, we'll start wearing a regular shoe. It might take 2 to 3 months before a dress shoe could be worn.
Good Lord.
Sorry, I know that's not the answer you wanted.
2 to 3 months.
I didn't see her face, but I was watching you.
I was
I could tell she was disappointed.
There's
Like,
no
what?
way, 2 to 3 months, that's crazy. Okay, so any final
Sorry.
words, of advice for people who have been suffering from bunions? I basically want you to tell people, look, you have options, there's no point, you see a lot of people, like my whole family, they just drag their feet and they think that's how God made us, so you gotta suffer. Okay, so when should they pick up the phone and consult with a podiatrist is what I wanna get out of you.
Okay. A person should see a podiatrist.
Start that over
Okay.
one more time, go ahead.
A person should see a podiatrist when they first start having symptoms. Initial x-rays can be taken. We usually will measure the amount of,
No, it's okay,
I
start
can't think
over.
of the word I'm looking at.
The degree of pain or?
Oh, right, that would have been a good thing. Okay, let me start over.
Yeah, start
What
over.
am I talking about again?
Yeah.
Oh, when do you see a podiatrist?
Yeah,
Okay.
when to see a podiatrist.
A patient should seek a podiatrist when they first start having symptoms, pain, or notice an enlargement on their great toe. At that point, initial x-rays will be taken and we will start conservative treatments. We will also take initial x-rays just to see how bad the bunion is as far as the joint moving away from the normal position.
Okay, and then let's talk, no, that's perfect. And then what about, again, quality of life post-op? Patients, are they happy? Is it,
Oh, yeah.
is it giving them a better quality of life? Let's
Mhm.
just sum it up with that, most of the time, obviously, the
Okay.
surgery makes people happy.
Sure.
Go ahead.
Once a patient has fully recovered from bunion surgery, they can resume all of their activities. They're very happy with the surgery. I don't know what else to say.
No, that's it, and they can go about their
And can
activities.
return to the regular-
Yeah, their
okay.
regular, whatever, activities, and let's do that one more
Okay,
time.
okay. Once a patient has fully recovered from the bunion surgery, they're usually very happy with the procedure. They can return to their regular shoe gear and all activities without a problem.
We're done.
Is that better?
2 out of 3